I would love if you would introduce yourself
Yeah.
and just tell us a little bit about your credentials and what led you to start, or I believe you founded, right, Acumen Assessments?
Yes, I
Okay.
did. So I'm Peter Graham. I'm a psychologist, a licensed psychologist in Kansas. I have a clinical and forensic practice. We specialize in doing evaluations of licensed professionals. We also specialize in doing treatment, education, and coaching for those same licensed professionals. Um, I began my training in doing this work back in 1992 when I was a postdoctoral fellow at the Menninger Clinic, which used to be in Topeka. At the time, Menninger had a professionals in crisis program where licensed professionals who were having mental health difficulties or addiction difficulties were referred for residential treatment. We were also at the same time doing outpatient evaluations of licensed professionals for fitness to practice. And I did that work throughout my time at Menninger, and then began doing this work full time in 2002 with a group of colleagues here in Lawrence, Kansas. 3 years later, we founded Acumen Assessments. And then 3 years after that, we founded Acumen Institute, which is the treatment, education, and coaching side of what we do. So this has been a type of work that I've been doing since the beginning of my postdoctoral career. So I received training in this work back in the 90s, and then have been doing it full time for, at this point, 18 years.
I see.
So as far as what we do at Acumen, the work that we do falls under two headings. First of all, the evaluations that we do are forensic insofar as we're providing an objective expert opinion to someone who is legally empowered to make decisions. In this case, we're offering an expert opinion to licensing boards, or by extension, the professional health programs that are in every state that coordinate with licensing boards to address professional health. Right. The area that we focus in is on the assessment side, is doing fitness to practice evaluations with professionals who are in safety sensitive professions. So that is, they've been given a license in a profession by the state, where their professional duties include the care of other human beings. Obviously, mainly we're talking about healthcare professionals. We also work with legal professionals because they've been licensed by the state, and they have an ethical and moral obligation to their clients as well. But specifically with regard to healthcare professionals, there's a safety sensitive nature of the work, right? The provider is licensed by the state to do things that take care of others and can potentially be injurious to others. So there's the safety sensitive component to the work. As a consequence, the mental status and the emotional fitness of licensees is falls under the purview of licensing boards, right? So in your case, anesthesiology assistants are licensed by the state to deliver healthcare services that can have a direct impact on the wellness of a patient, including a direct impact on their life. And as a consequence, the state takes a direct interest in that provider's ongoing mental fitness and emotional fitness and well-being. So where we come in is that we are neutral providers of fitness to practice evaluations to those safety sensitive professionals.
I see.
Shall I go on and address the other questions that you've?
Yeah, I have a question just to interject off of the script, but
Sure.
Do you need to have a fitness to practice assessment as part of the healing arts, algorithm for either getting back your license or proving that you shouldn't have your license taken away? Is that an absolute thing?
Well, usually what happens is a difficulty or an event is either complained about or observed, and a question is raised about the fitness of the provider. That question is initially raised usually at the level of the department and the hospital administration and the clinical leadership within the hospital in the case of an anesthesiology assistant. Now, sometimes the nature of the transgression, if there was a transgression or the difficulty, requires that there be a report to the licensing board.
Mm-hmm.
Sometimes it's possible that, and this really depends from state to state on the policies and the regulations of that state. But most states are required. Most hospitals are required in most states to refer providers about whom there's a question of risk to the state physician health program or professionals health program.
Mm-hmm.
Or they might be required to refer that provider directly to the licensing board, at which point it's usually the case if there's a question about fitness or illness in the provider, the board will often defer its decisions until the provider is referred to the professionals health program, which can then refer that provider to a fitness evaluation.
I gotcha. So the class we're heavily focused into substance abuse, but obviously you deal with, you're saying difficulties or transgressions. Can you give us a sense of sort of, I don't know how many specific anesthesia personnel you've dealt with. I don't believe you've dealt with any CAAs yet,
We've
correct?
mostly worked with CNAs and CRNAs and anesthesiologists.
Okay. Is it legal for you to just share, what types of events that people are coming to you for? Is it all substance abuse or, what other?
You can really think of it in describing that fiduciary duty that licensees have to the state, right?
Mm-hmm.
To be responsible, to maintain fitness. There are a number of different types of problematic behavior that licensees can engage in that can raise concerns about fitness. Obviously, misuse of substances and addiction is one very significant issue. Mm-hmm. But other forms of disruptive behavior in the workplace, either aggressive disruptive behavior or non-collaborative behavior with colleagues, or also there's an array of sexualized behaviors in the workplace, everything from sexual harassment to sexual misconduct that can lead people to be referred to us. And then there are also cases where there's just frankly some type of psychiatric illness that's affecting the person's mental fitness. It may be depression, it may be bipolar illness, it may be an anxiety disorder, post-traumatic stress disorder. So the different types of trouble that human beings can get into can impact fitness.
Okay.
And drug use is one of those.
Okay. And a recommendation to go to Acumen Assessments for a CAA might come from their private anesthesia group or the hospital and still be independent of the licensing, like the Missouri Board of Healing Arts.
Usually the board in Missouri's case, providers can be referred to the professionals health programs. And as long as the provider is cooperating with and compliant with the recommendations of that professional health program to seek an evaluation, to follow whatever recommendations stem from that evaluation, the provider can maintain anonymity from the licensing board.
Okay.
There are some states where there isn't a separation between the board and the monitoring program, and all providers who come for help are known to the board. But in Missouri's case, there is confidentiality as long as there's compliance.
Okay, wonderful. Thank you for that specificity for us, because I'm trying to, as you know, create a timeline for people to sort of get the knowledge in case they were ever to need your help or to know someone who needs your help, so that it's not a fear, an unknown, but you know, these are the steps, these are the people who are here to help us.
Yeah.
So thank you.
I
And
would recommend anyone who's either concerned about a colleague or concerned about themselves, you know, to research the statutes in Missouri, the regulations and the statutes that regulate practice in your state usually include specific guidance about what providers who may believe that they might have a condition that might be impairing them, what they can do to responsibly address that. But
I did take a look at our statutes, and it's pretty vague, which I guess isn't super surprising to me, which is why I kind of want to come back in here and get some more specifics. But basically it said that there's an oversight committee that's made up of CAAs, anesthesiologists, and members of the Board of Healing Arts, and that they're going to decide, like they're going to create, you know, whatever sort of yes or no, what am I trying to say? Like they're going to, thank you. Yes. It didn't really have, you do this, then you do this, then we hear your side, and then you do this. It wasn't as specific as that.
Yeah. I think the important thing at this point in the educational process for people who aren't experiencing difficulties, but who are entering their careers, it's important for them to understand that all licensees are going to be held accountable to the maintenance of their fitness, and that it's important, just like it's important when we sign for our license, every time we renew our license, that we say we've read the statutes that regulate practice in our state. It's important to stay up to date in terms of what's expected, what's expected in terms of the maintenance of fitness, but also what avenues are available to a person in the state of Missouri if somebody might be experiencing difficulty.
Yes.
And I believe that the professional health programs in the state, I'm most familiar with the Missouri Physician Health Program and the Missouri Association of Osteopathic Physicians and Surgeons Professional Health Program. The second program works, I think, with a broader array of health professionals.
Yes, they would work with us if we need it, if we requested their help, which we're suggesting everyone to request their help.
and they're a program that's always interested in having preventive conversations with licensees so that those licensees are educated before they ever experience any difficulties. Yes.
I am also going to be interviewing them for this. So thank you for that lead. I think it would be really helpful if you maybe took a pretend patient for you or a colleague for me that maybe is specifically running into substance abuse issues, and kind of just give us a picture of what we would expect once we were to, you know, get your services.
Yeah. Well, you know, first of all, people in the field have to appreciate that the unique access to, you know, significant pharmacology is very important to sort of have a sober appreciation of the weight of that responsibility. Usually people who are in the anesthesia field, all the different disciplines that work with anesthesia, the main problem that they present with is substance use problems, right? That may be the use of legal substances in their private life, like alcohol or other illicit substances that are in some states no longer illicit, like marijuana. Even though alcohol and in some states marijuana are legal, it doesn't mean that they're not potentially dangerous drugs that can seriously affect fitness. But you know, the misuse of those substances, the diversion of controlled substances in the workplace, these are the kinds of problems that anesthesiologists, CRNAs, and anesthesiology assistants present with. So the first part of the referral really comes to us either directly from a hospital or from a professional health program. And the first discussion is focused on the planning of a fitness evaluation, right? Because the first order of it, unless the person is basically presenting with a clear-cut addiction for which they're, volunteering their acceptance of the problem, in that case, the individual can be referred directly to a treatment program. And there are treatment programs all over the country that are specifically designed to provide specialty addiction treatment for safety-sensitive professionals, right? So that's one route into this whole process, is directly into treatment if the person believes they have an addiction. If there's some question about the nature of the problem, the referral for a fitness evaluation is made.
Okay.
And depending on the person's level of licensure and their level of responsibility, there are sort of different levels of intensity to the fitness evaluation. But regardless of whether it's a 1, 2, or 3.5 day process, it's going to include several key ingredients. There's going to be a referral of collateral information from the workplace. So complaints, written reports, investigation reports, right? If there's some question about diversion of anesthesiology drugs in the workplace. There's going to be a psychiatric and addiction evaluation done with that individual. Other psychological evaluation aspects like a developmental history, work history, psychological testing, both personality testing and neuropsychological testing. And the reason for that is that's part of a systematic way of evaluating current mental status, right?
I see.
Mental status in terms of the clarity of the mental functions, but also determining the presence or absence of a clinical syndrome like depression or post-traumatic stress disorder, or addiction for that matter, if the person's endorsing addiction-related symptom. Once all those different elements of the evaluation process are completed and the collateral materials are reviewed, interviews are done with relevant contacts from the workplace, the supervisor, the chief administrator, whoever's involved from the administration side of the hospital, then those elements are integrated into a set of findings with regard to the person's fitness and their mental status. And then recommendations are made about the person's current level of fitness and what recommendations need to be followed in terms of treatment, education, or monitoring in order to help that person come back to a level of full fitness that would allow them to return in a planned and systematic way back into the workplace. So that evaluation process may lead to referral for primary addiction treatment. It might lead to a referral for some type of intensive outpatient process with psychotherapeutic and psychiatric components. It might include a recommendation for formal monitoring with one of these professionals' health programs. And that would include, if it's appropriate, ongoing screening for drugs of abuse and the expectation of abstinence. And then there might also be expectations for participation in support groups for professionals who are in recovery and who are in monitoring. Usually states have monitoring support groups for licensees of different disciplines, physicians, nurses, anesthesiology assistants. So that person has a professional support group.
Yes, there is not currently one for anesthesiologist assistants, which is something I think we also need to address, but I think we would be underneath the MAOPS, support system. So
they have what are called caduceus groups, which is basically health professional support groups around the state that people who are being monitored can attend on a weekly.
Oh, okay. I didn't know that.
Yeah. So there are, for example, there are meetings in the Kansas City area that licensees can attend.
Okay. Like an AA meeting, but for health professionals who are, have more specific struggles, more or trying to get back into the workplace.
Yeah. Well, the important thing to remember here is that when we have a healthcare professional who's in a safety sensitive profession, there are unique requirements, both for support, right? You need to be surrounded by other people who deal with the same stressors that you do. And there's also the accountability piece, right? The average private citizen who's in a recovery process doesn't really have a formal regulatory accountability to anyone because, as long as, for example, as long as they're not driving under the influence of a drug, they're not really going to have an accountability to the state. But because providers have licenses, there's that added level of accountability that makes it necessary for providers to participate in a monitoring support group.
I see. And you had said a while ago that if you were to show that you initially needed to seek inpatient treatment, that you would be able to, you would not go to Acumen Assessments, you would go immediately to treatment, and that whole process would be kept anonymous, I think you had said.
It could be kept confidential.
Okay.
The agreement that MAOPS, for example, has with the Missouri board is that if a participant is referred in good faith to the program, they follow the recommendations of MAOPS to pursue an evaluation or to directly pursue treatment. And they're complying on an ongoing basis with the recommendations of that evaluation and treatment process. And they fold back into a monitoring process that they remain compliant in. It's possible to eventually return to work, stay in monitoring, and remain confidential.
Okay, confidential from the Board of Healing Arts and also confidential from, the other members of your practice is what I'm understanding you're saying?
Yeah, there are, in the case of an anesthesiology assistant returning to the workplace to do anesthesiology services, there will often need to be some level of awareness, at least at the supervisory level, that this person is returning from treatment and that they're being monitored by the state.
Okay.
And this is particularly an issue in the anesthesiology specialties because the level of risk is for relapse, the level of risk to the patient if the person is impaired is so much higher.
Yes.
Than if there are other specialties where it's easier to control that person's access to controlled substances, whereas an anesthesiology assistant returning to the workplace is going to immediately be re-exposed to the controlled substances that they may have had a problem with.
Yes.
So that's an added level of safety sensitive treatment that has to be experienced before, and there's a whole level of planning that has to happen before the return to the workplace can take place.
Okay. Yeah, I'm thinking, just through all of the questions that I would be wondering, like, are my colleagues all going to find out if I get referred to Acumen Assessments or if I have to go to inpatient treatment? And the answer, it sounds like certainly everyone's trying to keep it confidential and anonymous, but certain people are going to have to know certain things so that everyone can stay safe.
Yeah, this gets at the sort of the central notion of accountability. That's an important word for your folks to keep in mind. We all have a level of accountability that we have to maintain as licensed professionals. And certainly accountability is emphasized in the monitoring process.
Yes. Okay. All right. Thank you. I had a question, if you're noticing any trends up in substance abuse. I mean, I guess even specifically over the pandemic or just in anesthesia at large, if you're noticing more problems.
There's no doubt that the epidemic has led to an epidemic of acute stress in providers. And that is definitely having an impact on people's vulnerabilities to misusing substances, experiencing other forms of impairment, mental health related problems with fitness. So that's definitely one trend. The other trend that we've been dealing with it for so long, it's kind of hard to keep calling it a trend, but the opioid epidemic in this country, the easy accessibility to highly potent opioids, fentanyl being the prime example. when fentanyl came on the market early in this century, there was a rapid escalation in serious opioid use problems in healthcare professionals because fentanyl is such a profoundly powerful. I mean, if you think about the morphine equivalence of a fentanyl as opposed to a straight, even just Demerol. It's been so all of the different opioids have been for easily the last 20 or 30 years a serious epidemic problem. There are states are now imposing structures which are beginning to make a change in the way that providers are prescribing. There have also been changes in the way hospital organizations are managing access to those drugs. You may have seen this over the course of your career so far. The way that controlled substances are accounted for has become a lot more strict and formal. But when someone is addicted, they will find ways to access. And the waste container is target number one. But we've also seen instances where someone doing anesthesiology in the OR has turned around and literally abused gas in the room in the middle of a surgery. That was beyond your average addiction. That was a psychotic episode in that person's case, but they were depressed. But sometimes it involves diversion out of the workplace of these substances, but some people are using this directly in the work environment. That's a natural consequence of addiction.
May I ask a quick question on, you just said that, or you alluded to maybe that your patients are getting the easiest and the highest level of access in the sharps container and the waste container.
That's one way that
oh, okay. I didn't know if that's something you hear over and over again, because we certainly have talked about, the different ways that that it's accessible, and not just when you're drawing it up from the syringe. So I didn't know if that was a big thing or that was just a remark you made.
No, that's a frequent thing that people will be caught engaging in. There's the steps in the wasting process are the key moments where diversion will often take place. Because that's the one point in the process of use of the formal use of the substance in the delivery of service where there's the highest potential for fudging.
Yes. It's sometimes surprising how loose the process appears in terms of, as you said, our own accountability is of utmost importance. And oftentimes that's truly the only thing that's standing between you, being honest or you diverting.
Yeah, and unfortunately, when somebody's under the influence of an addiction, their brain will do things that their brain would not otherwise have done if they were not addicted to the substance. And this includes under administration of the patient in order to save more for themselves.
Yeah. To go back just a little bit, after we have our initial assessment with you, you said it could be 1 to 3 days. Is that with us on your property?
Yeah, usually leaving the COVID epidemic aside for a minute, the usual protocol is that individuals come to our office for the days of the evaluation. And there are many reasons why that's important, but the main thing is that the evaluation is happening in a neutral site, and in a controlled, standardized way. We do the same thing in the course of doing any fitness evaluation. It's part of standardization, right? So that we can focus as much as possible on what this specific individual is struggling with and what kind of troubles they're specifically having. The process usually ends with an initial feedback to the individual. In the case of addiction, where it's really paramount that there is a health condition that requires immediate action, oftentimes that feedback process at the end will include bringing the referral source in on the conversation so that there can be an immediate discussion about what the next step is going to be.
I see.
There are some people who are fragile enough that they need to essentially be helped to get directly to treatment.
Okay.
Oftentimes, in the case of fairly clear-cut addiction situations, the provider will be referred to an evaluation provider that is itself within an addiction treatment program.
Oh, okay.
There are safety-sensitive professional programs around the country that also do evaluations and treatment like we do. You know, the reason for having a potentially addicted provider go to an on-site facility like that for their evaluation is because there's been some assessment at the outset by the referral source that you know, this person, there's a higher likelihood that this person may be actively in an addiction, and there may be concerns about withdrawal.
Oh, okay.
If that problem is identified in the course of the evaluation.
Okay.
And there is risk involved, right? I mean, if somebody's actively addicted, under the influence of substances, they're in need of a higher level of care quicker than say a provider who comes to us for disruptive behavior who's not currently addicted to substance.
I see. Okay. And then do we come back and see you at any point? You know, let's say we are referred to, let's say, you know, outpatient treatment. Does MAOPS set up with us, you know, some sort of reassessment by Acumen throughout the course of, you know, whatever the timeline is, or once we see you, that's really it?
Usually what happens once a person is referred for treatment is that they will engage in that treatment process, and the treatment provider will make a determination that the individual has made sufficient gains and is manifesting sufficient current, you know, mental status fitness that they're able to make a determination in the treatment setting that this person's ready to begin to implement their return to work plan.
Okay.
You know, and obviously the development of a return to work plan and a relapse prevention plan is part of that treatment program. So that planning will need to be completed before the person is discharged from the treatment program. But it's usually especially in the case of substance use problems, the secondary evaluation of return to fitness will be made by the treatment providers in the treatment setting.
Okay. All right. So it doesn't sound like we should expect to then have to, you know, a final visit with Acumen or, okay.
Not routinely.
Okay. All right. Thanks.
Sometimes in the course of undergoing a primary addiction treatment, some providers, it also turns out, are identified to have other mental health issues, behavioral issues that require attention. Sometimes people are referred to our treatment program, which is not a primary addiction treatment program. There are a lot of primary addiction treatment programs around the country that specialize in providing safety-sensitive health professionals addiction treatment. Our treatment program focuses on all of the other difficulties that I was describing.
Oh, okay.
And sometimes people, you know, so they may have boundary problems in addition to an addiction problem, and they may be referred to us for some treatment.
I see.
Of varying levels of intensity, depending on what their problem was, or they may need to follow up with us because they're from the area and they need ongoing outpatient psychiatric management and psychotherapy.
I see. Okay.
But usually, if that's necessary for providers in the Kansas City area, there are sufficient, you know, available providers in the Kansas City area that they can get referred to for ongoing follow-up care.
I see. Okay. I believe we're at our last question, unless you think any part of the process has been missed that we should hear from you.
Again, I guess I would just emphasize, you know, at this point where your learners are being exposed to this training, you know, it's really important that they appreciate that the biggest danger, unless they've already fallen prey to an addiction, the biggest danger is attitude. Right? And the resistance that comes from attitude. It's very important that as licensees in healthcare professions, we have a sober appreciation for the duties that we're privileged to have,
Mm-hmm.
and that we're as vulnerable as anybody else, regardless of our intelligence and our ability to achieve. We're as vulnerable as anyone else to having problems. And it's better if you start your career getting that into your head, that
Mm-hmm.
I'm not a super person, and
Mm-hmm.
I'm not immune. I have
Mm-hmm.
to, intentionally take care of myself from the beginning.
Mm-hmm. Mm-hmm.
That's an important mental step for people at the beginning of their career to take.
Yes.
Then just taking seriously the professional duties that come with licensure, and fully appreciating that the meaning of licensure is that we're being monitored because we've been allowed by the state to do something that's dangerous.
Mm-hmm. Mm-hmm.
Uh, we've all worked hard, earned advanced degrees, advanced training, have qualified for our license by passing exams, all of this stuff. And all that means is we're being given a privilege that we have to take. There's no entitlement involved.
Yes.
And that the work that especially anesthesiology assistants are doing is dangerous by definition. And I'm not sure what the American Association of Anesthesiology Assistants motto is, but the American Anesthesiology Association's motto is vigilance.
Yeah.
Right? And
Yes.
and I'm assuming that anesthesiology assistants have the same kind of motto, right? And so being vigilant to one's own frailties and vulnerabilities is just as important as vigilance to the patient and their staff.
Do you think that wonderfully summarizes or answers my last question, which is what can we do to stay out of your office?
Yeah.
But I didn't know if you had any sort of tangible, if you've seen over the years something that helps people maybe cope or, be able to identify the fact that we are, a vulnerable population, whether you want to believe it or not, if there's any sort of, mindset that we could have.
Well, I think it's important that people take stock of their own history, right? We're all capable of evaluating ourselves as well as being evaluated by other people. And it's important that we know going into our careers what our own history is in terms of mental and emotional struggles, exposure to substance use problems, experience of substance use problems in ourselves. We need to understand what our vulnerabilities are to those types of difficulties, but whether it's addiction or mental illness. It's one thing to counsel people to have balance, to have wellness in their lives, right? But to do the things that we know are healthy, like exercise, eat right, get good sleep, all of that. But mental mindset is really important. And one of the things that we approach we teach our clients about is intentional professional identity. We have to, like executives, have a strategic plan for our own careers, and a clear definition for ourselves about what it means to be, in your case, an anesthesiology assistant. Appreciating what the duties and responsibilities of that role are, appreciating what the definition of that role is, right, and how it fits into other people's roles. That's the way to sort of proactively manage one's career. Because it's usually a cascading accumulation of multiple factors that results in people misusing substances. So there really needs to be kind of a multifaceted approach to the definition and management of one's career and what it means to be licensed.
Well, that truly is my purpose with this class, is to allow people to see their own vulnerabilities and to create a mindset that's going to work for them.
Yeah.
as well as give them all this knowledge so that, I think fear can really hold people back from seeking help if they were to need it. So
there's an easy formula that we give to people that your learners can keep in mind.
okay.
Right? Potential for problems, right? If you think about it as an equation, the potential of having a problem in our careers is a function of, on the numerator, is risk factors. And as we've already talked about, anesthesiology assistants have built into their career multiple risk factors, plus personal vulnerabilities. And that has to do with our own personalities, our own mental health history, our own substance use history, things that are unique to us, vulnerabilities. And then in the denominator of that is accountability, right? Having good working relationships with supportive colleagues, having good supportive relationships in our private life, having a good ongoing relationship with people who can give us good advice in our professional lives, having a personal attorney, having an accountant, having a supervisor who we trust and who we use regularly, coworkers, a psychotherapist if you feel the need to have one, a dentist. I mean, there's a number of different people that it's a professional career is like professional athletics. You have to have a team of coaches that are working with you. And that in your case includes colleagues who can give you what my chief of staff used to call alternate vision, right? We can provide to each other in the collegial setting feedback about how we're doing. The work that I do every day is overseen by 6 other colleagues who I'm talking to every day, right? So that accountability part of that equation is really important because it helps us to counteract the vulnerabilities and the risk factors. Then the other thing we got to think about with this equation is that it's then bracketed to the power of resistance, and that those attitudes that I was talking about can make us that much more vulnerable if we're not open to the idea that there could be something in our personality that would make us feel impervious to problems. That's a dangerous mindset to have.
Yes. Thank you so much for those insights. That really drives home everything that we've been learning through this class. So I really appreciate your time. Thanks for sticking with us in the beginning.
No, it's my pleasure. We're all learning how to use this technology.
All right. Well, I hope you have a wonderful day, and potentially I might be calling you in the future if we have other questions, if that's okay.
Well, best of luck to all of your learners, and remember to tell them that that the best thing is to consult early, and providers like us around the country are always available to ask questions to. We would rather hear from people before they've gotten too far down the turnpike of trouble.
Sure. Okay. Well, thank you. Yes. Thank you so much for your time.
Okay. You're welcome. Bye for now.
All right. Bye.